Hi everyone, thanks for listening to all my presentations. Today I'll continue on snake bites, but specifically I'll be talking about antidote to snake venom. Anti-snake venom. It is an immunoglobulin. It is the only known effective antidote to snake venom. It could be monospecific or otherwise known as monovalent when it is specific to a particular species of snake. Could be polyspecific or otherwise known as polyvalent when it is effective against many species of snake. There may be paraspecific activity when antibodies developed may be effective against other venoms from the same species or closely related species. Mechanism of action. Anti-snake venom, like ovarian, is a venom-specific file fragment of immunoglobulin G. Anti-snake venom binds and neutralizes venom toxins. That will enhance the redistribution away from the target tissues, and subsequently, it will be eliminated from the body. The fragments are safe, and they are also very effective. There's low incidence of sequelae, if at all. As far as monospecific anti-snake venom, otherwise known as monovalent anti-snake venom, is concerned, we need to weigh merit and demerit. Merit here is that it is the best if it is available, but demerits are making the diagnosis of the specific snake involved is a difficult thing, because it's not likely that the affected individual will be able to describe precisely the snake, and you might not see the dead snake. Besides that, it's also very expensive and not easily available. Form. Antidote to snake venom, otherwise known as anti-snake venom, will appear in powder form. It is to be reconstituted with about 10 ml of normal saline or D5. Please, no rigorous shaking. Only have gentle rocking when you are mixing. Indications for the use of anti-snake venom. The number one point here is that it is not to be used in all snake bites, meaning the fact that the individual has presented with history of snake bite doesn't mean we should grab anti-snake venom and just jab the patient with it. No way. So if that is the case, when are we going to use it? Okay, we will use it when there's history of snake bite, and now we are faced with systemic envenomation, or when we have history of snake bite, and now we are dealing with massive local reaction, or snake bite history, and now we are dealing with systemic bleeding, or there's clotting time that is greater than 20 minutes, or there's thrombocytopenia, or we are faced with shock in an individual already bitten by snake. Still, part of indications is history of snake bite and now having arrhythmia or abnormal EKG, or history of paralysis or renal failure that is acute, or hyperkalemia, or features of rhabdomyolysis, muscular pain, or ptosis. Timing. Time, they say, is of the essence, and that's why it's pretty necessary to get to the hospital as quickly as possible. We should give the first dose of the anti-snake venom within the first 1 to 4 hours post-bite. But for logistic reasons, either the individual has been bitten in the jungle and could not be transported to the hospital on time, or the distance is pretty far, we can still wait and delay the first dose for that purpose, but not greater than 24 hours after bite. Dose. Please, there is no fixed dose for anti-snake venom. The degree of envenomation will determine the dose of the anti-snake venom to be used. But the general rule is that the start dose will go thus. If the envenomation is mild, you can use 5 vials or 50 ml. If the envenomation is moderate, you can use 5 to 10 vials or 50 to 100 ml. If you are dealing with severe envenomation, then you can use 10 to 20 vials. Repeat dose. You've given your start dose, right? You have to observe for some hours. You can repeat the dose if hemostasis is not achieved after 6 hours. You can also repeat the dose if there is continual bleeding after 2 hours post-start dose. If neurotoxicity is still persistent, you can repeat the dose. You can also repeat the dose if you are battling with cardiac-related anomalies after 2 hours post-start dose. Administration. Anti-snake venom should be given very slowly. Slow IV injection at the rate of 2 ml per minute or slow infusion is required. We have to dilute the anti-snake venom with normal saline or D5. We can give a vial over an hour. There must be close monitoring, please. We have to observe the patient taking this medication for 1 hour at least. It would be nice if you can get a nurse or, better still, a doctor to watch the patient. Watching for anaphylactic reactions is required. And then you have to keep the rescue agent at hand, like adrenaline if you're in UK, or epinephrine in North America. Then Benadryl, salbutamol, and corticosteroid. Still on administration. No bite-side injection, please. And no infiltration with anti-snake venom, please. No intramuscular route unless there is no intravenous access or there is no one around with a scale to set the IV line, or monitoring for anaphylaxis will be a big problem. Then you may choose the intramuscular route instead of intravenous route. There is no need for sensitivity tests to anti-snake venom before the administration of anti-snake venom. Signs of neutralization, meaning signs that we are winning. When the blood pressure has returned to normal, that's a good sign. When bleeding has stopped within 30 minutes, that's a good sign. When there is improved neurotoxicity signs and symptoms, then we are winning. When local signs are not getting worse, then it means we are achieving neutralization of the venom. Our expectation. We will expect a full recovery from snake bites after being treated with anti-snake venom within 24 to 48 hours. Side effects. Side effects of anti-snake venom will include 1/5 will either have an early or late reaction, meaning if you treat 5 people with anti-snake venom, 1 out of 5, that is 20%, will either have early or late reaction. What are the early reactions that may occur within 10 minutes to 3 hours? They are the following: itching, abdominal pain, urticaria, dry cough, nausea, vomiting, diarrhea, tachycardia, fever, and anaphylaxis. Late reactions will include serum sickness type reactions within the first 1 to 7 days, and that will include fever, nausea, vomiting, and diarrhea, itching, recurrent urticaria, arthralgia, myalgia, lymphadenopathy, nephritis, and encephalopathy. Treatment of reactions. If we are faced with any of the reactions mentioned previously, like serum sickness, we can grab antihistamine, for example, chlorpheniramine, at 2 mg every 6 hours in adults, or 0.25 mg per kilogram per day in divided doses in children. Then we can use prednisolone, 5 mg every 6 hours in adults, or 0.7 mg per kilogram per day in divided doses in children. We should also have at hand epinephrine or adrenaline, depending on where you are, hydrocortisone, Benadryl, or salbutamol. With that, I've come to the end of this very presentation. The next presentation on snake bite will cover the epidemiology, the different types of snake with examples, and some associated clinical signs and symptoms of their envenomation. Thanks for listening. Please remember to share this very presentation. Remember to subscribe so that you can get the next presentation and other presentations from me immediately they are published. I appreciate it.